was beginning my career as a junior faculty member at Dartmouth, I wanted to study differences in the ways that vascular care was provided to patients who are at risk for amputation. I thought that perhaps there were places in the country where very intensive vascular care was offered, lots of procedures, whether they were stents, surgery, wound care, or others. And I thought there were other places in the country where very little vascular care was provided, and I wondered what effect those differences had on patient outcomes. The SVS Foundation was critical in offering the early support to develop the preliminary net data that was necessary to fund this research.
Specifically, my research focuses on diabetes and diabetic wound healing. I focus on particular cells, macrophages that are involved in inflammation, and how those cells are altered in conditions like diabetes. My research also extends into looking very specifically at how these cells are more inflammatory in other conditions as well as diabetes, such as peripheral arterial disease and aneurysm formation. And specifically, I look at how these cells are altered through epigenetic mechanisms and try to restore some of the normal function of these cells so that we can hopefully improve patient care and improve outcomes for a lot of these patients who unfortunately wind up needing amputations because our treatments are not optimal.
I received the Society for Vascular Surgery Foundation Clinical Seed Grant, and I've been using that funding to study and better understand amputations and why they occur. In particular, my research is about understanding amputations in very rural areas like the state of West Virginia, and I've been using the funding to perform a mixed methods analysis of the issue. So I think amputations for vascular surgeons is one of the most upsetting things that we do as surgeons, mainly because it's an extremely preventable problem. As we know, 85% of amputations related to diabetes are preceded by a foot ulcer, meaning if we can catch that foot ulcer and take care of that patient earlier, or even prevent that foot ulcer from happening, we can make a huge impact on our patient population. And so I think as vascular surgeons, we all feel terrible when we have to do amputations, and we all feel extremely terrible when someone comes in and it's just so late in the game that we can't do anything to help them. And so I think we're particularly situated to care about the issue, to be passionate about it, and also to make a difference because we have a particular understanding of what happens that other specialties don't really have.
I was lucky enough under Howard Geisler to obtain the Resident Research Award for work done in his lab during my general surgery training at Loyola University in Chicago. And then more recently, I was able to get the SVS and American College of Surgeons matched funding for my KO8 award. My KO8 was looking at the molecular mechanisms of flow-mediated stiffness. This finding is that the modifiability of the artery stiffening may be a unique opportunity for new therapies that can not only improve function of our patients, but possibly delay the onset or severity of atherosclerosis.
One of the greatest things about the Society for Vascular Surgery Research Award that I received was that it gave me support to research telemedicine and how to bring telemedicine to patients in rural areas so that they can get optimal care. And I've used this a lot in my thoracic outlet practice. Whenever I do these visits, the nursing staff can also interact with the patient and they really enjoy it. And this particular patient had an exceptional result after her surgery. She had been debilitated for several years, and after we did decompression of her first rib, we saw her through a telemedicine visit, and she was ecstatic. She was raising her arms up, she was smiling, she was telling us how she was out of pain and how she was able to stop taking opioid narcotics. And it was really great because not only did I get to see her, but my clinic staff also got to see her through that visit.
I think one of the most rewarding things about my SVS Foundation support has been the ability to impact the lives of others. And in fact, I think one day when the SVS Foundation looks back, it won't be that investment in me, and yes, it has yielded millions of dollars in support subsequently from the NIH and the American Heart Association. But the best part of my life is impacting the careers of early clinician scientists and surgeon scientists. I think by having this program, we attract the very best and the brightest into vascular surgery, and we retain them in the surgeon scientist community. I've been associated now with 35 different postdoctoral fellows, bright surgical residents, medical students who have worked in my lab shoulder to shoulder with me. And one of the most rewarding things for me is to see them go out and start their own research programs. I think that will be the real impact of these investments by the SVS Foundation on the future of how we care for our vascular surgery patients.
In addition to the actual financial support from the SVS Foundation, the impact of that support is much greater than one might think. In addition to helping me to develop into an independent surgeon scientist, what that support did was help to generate research that served as preliminary data for multiple subsequent independent grants from the NIH, Department of Defense, the American Heart Association. So the return on investment is vast, not only from personal career development, but the impact that one can have on patient care.